Hello, I'm Chatushka Samradivakara and today I'm going to do a presentation about nephrotic syndrome. This is my name and the date that I'm doing my presentation, and I'm using this as a flashcard. Nephrotic syndrome is characterized by massive proteinuria, lipiduria, hypoalbuminemia, hyperlipidemia, and generalized edema. Nephrotic syndrome is not a specific glomerular disease, but it is a constellation of clinical findings that results from an increase in glomerular permeability and loss of plasma proteins in urine. And any increase in the glomerular membrane permeability allows proteins to escape from the plasma into the glomerular filtrate. Massive proteinuria results leading to a hypoalbuminemia. Then the generalized edema, which is a hallmark of nephrotic syndrome, results from the loss of colloidal osmotic pressure of the blood with subsequent accumulation of fluid in the interstitial tissues. There is also salt and water retention, which aggravates the edema. This appears to be due to the several factors, including compensatory increase in aldosterone, stimulation of sympathetic nervous system, and a reduction of secretion of natriuretic factors. Initially, the edema present in dependent parts of the body, such as lower extremities, but it becomes more generalized as the disease progresses. Also, dyspnea due to pulmonary edema, pleural effusions, and diaphragmatic compromises due to ascites can develop in persons with nephrotic syndrome. The three syndromes from the same body system that I chose is acute renal failure syndrome. It is a sudden and sustained deterioration of kidney function, and it can be characterized by decreased glomerular filtration rate, increased serum creatinine, or oliguria. It can result from decreased blood flow to the kidney, disorder that disrupts the structure in the kidney, or the disorders that interfere with the elimination of urine from the kidney. The second one is chronic renal failure syndrome. It is a condition in which the kidneys are damaged and it cannot be filtered blood as well as they should. Because of this, excess fluid and waste from blood remains in the body, and it may cause other health problems such as heart diseases and stroke. And some other health consequences of this disease is anemia or low number of red blood cells, and it increased occurrence of infections and low calcium levels, high potassium levels, high phosphorus levels in blood. Also loss of appetite or eating less, and depression all over the quality of life. The third one is obstructive urinary syndrome. The urinary obstruction can occur in people in any age, and it can involve any level of the urinary tract, from the urethra to the renal pelvis. Obstruction may be sudden or insidious. It can be partial or complete. It can be unilateral or bilateral. The conditions that cause urinary tract obstruction include congenital anomalies, urinary calculi, pregnancy, benign prostatic hyperplasia, scar tissue injury, resulting from infections and inflammations, tumors, and neurological disorders such as spinal cord injuries. Obstructive uropathy is usually classified according to the site, degree, and the duration of the obstruction. The next one is the three diseases in the syndrome. The first one is the minimal change disease. It is also called lipoid nephrosis. Minimal change disease is characterized by the diffuse loss of the food process of cells in the epithelial layer of the glomerular membrane. It is most commonly seen in children, but may occasionally occur in adults too. The cause of minimal change nephrosis is unknown, but although minimal change disease does not progress to renal failure, it can cause significant complications including thromboembolic events, hyperlipidemia, and protein malnourished. The second one is membranous glomerulonephritis. Membranous glomerulonephritis is the most common cause of primary nephrosis in adults. The disorder is caused by diffuse thickening of the glomerular membrane due to the depositions of the immune complexes. This disorder may be idiopathic or associated with a number of disorders, including autoimmune diseases like SLE, infections such as hepatitis B, and metabolic disorders such as diabetes mellitus. The presence of immunoglobulins and the complement in the subendothelial deposits suggests that the disease represents a chronic immune complex mediated disorder. This disorder usually begins with an insidious onset of the nephrotic syndrome. The third one is the focal segmental glomerulosclerosis. It is characterized by sclerosis. It is a particularly common cause of nephrotic syndrome in Hispanic and African Americans. Although focal segmental sclerosis often is an idiopathic syndrome, it may be associated with reduced oxygen in the blood, HIV infections, or intravenous drug abuse, or it may occur as a secondary event reflecting glomerular scarring due to the other forms of glomerulonephritis. Thank you.